This is a new channel from Unacademy called Unacademy Future Doctors, and I am your educator for biochemistry, Dr. Shivangi Shukla. Do let me know if I'm visible and audible to all of you. I'll just check once if I'm visible and audible, and then we'll start. Let me just check if the live stream has started. Hi Vikas, hello, how are you? Okay, so this is a very interesting session on clinical biochemistry. We shall be discussing a case study tonight. I'll give you the scenario, and then you have to tell me the diagnosis and the management. Then we'll have a brief discussion over it. All right. I'm not going to tell you what is the topic, because otherwise, what will happen is you will get some idea. So I want you guys to start from scratch. You just have to look at the case thing, and then you have to decide on the diagnosis and the management. All right. Um, so let me just quickly take you through the different types of subscriptions for NEET PG that are available on Unacademy. The Plus as well as the Iconic subscription. The Plus subscription comes with access to lectures from top educators across the country. You get to access their live as well as video lectures, and they conduct regular live quizzes, all India level, or you can attempt the quizzes in real time basis, and using the state of the art technologies like polls, raise your hand features, ask a doubt, and a lot more. Okay, so that can give you a simulated environment of the physical classroom. Okay, and the best thing is that you can access it while on the go, so learn while you're on the go. Okay, and the Iconic subscription comes with access to resources from Prep Ladder as well. Hi Harshita Dhidi, hi, hello, good evening, how are you? Okay, so what we are going to do tonight is we are going to discuss a particular case, and you have to tell me what the diagnosis is, and you have to make the diagnosis from the information that I'm providing you, and then you have to tell me about the treatment. Okay, we have read the theory behind it, so I'm going to quiz you on this just to develop your clinical skills. All right. So whichever subscription you wish to take, please do not forget to put in the educator code, that is DRSHUKLA, because it is going to fetch you an additional 10% discount. Okay, guys, in today's scenario where COVID is increasing again and again, and most of our activities have been restricted to the home, to our house, to our home. Now, even learning has been gradually shifted towards the online mode, isn't it? So, and Unacademy is offering you very subsidized prices. Okay, so please do try this out, try this subscription out, because it is going to help you a lot. It is going to regularize your studies, build a discipline, a regimen, a particular regimen, and it is going to help you a lot. Okay, because time and again a lot of cases have been rising, and there can be your studies can the regularity can be affected. So it is better that you follow a particular routine, and Unacademy will provide you that through this subscription, and it is not very costly, guys. Okay, so please do try this out. All right, so are you guys ready? No one answers till I have completed the question. You should just look at this question, read it out, and then you have to attempt it. Okay, all right. Now the scenario is, this is the history. Okay, a 1-year-old male child, 1-year-old male child born through a consanguineous marriage was brought to the OPD by the parents after they noticed global development delay, poor visual skills, and decreased pigmentation of the skin and the hair in the child. Okay, they also give history of episodic rigidity of the lower body. Alright, so this is the brief history that has been told to you in the question. You have to take it as an MCQ. Okay, or you can also get this like a long question, or in a Viva scenario also this can be asked of you. Okay, just look at this. What have you understood? Give it 1 minute and understand the question. Just mark the keywords. Okay, mark the keywords, read it out, and then mark the keywords. What is important in this? Come on, all of you, do understand what are the keywords. The age of the child. Then what is the peculiarity about the parents. Then what is the history, what are the symptoms that the informants are giving you, and this is it in the history. Okay, next. On examination, you notice that the child is average weight for age, that means normal weight. Okay, his weight is average for age. Hypopigmented hair and scalp. This is the sign that you notice. This was also the symptom that the parents had noticed, the child's parents had noticed. And you notice there is increased tone, spasticity, rigidity in the lower limbs of the child. Okay, and of course you notice that there is development delay. That also you will notice. What is development delay? What is global development delay? Can you tell me? Global development delay means all the milestones for the age have not been achieved. Okay, what are the milestones? The gross motor skills, the fine motor skills, the social skills, and the language skills. None of them have been achieved. Okay, got it? None of these four has been achieved. So there is global development delay all throughout. In all the spheres, the development has been delayed. The milestones have not been achieved. Okay. Next, you order an investigation. Okay, now since there's the development delay, there's history of episodic tonicity, okay, spasticity. So that can signify seizures in the child. Okay, so you order an MRI. Okay, an MRI brain you order, and on that you find there is microcephaly, there is atrophy of the brain matter, microcephaly, small brain, and there is severe global development delay. Okay, there is severe global development delay noted on MRI brain. Okay, now are things getting clearer to you or not? Then you have ordered urine and serum amino acids. Okay, and you find that serum phenylalanine levels are 450 micromoles per liter. Normal is 31 to 75, so it is raised. You find the ferric chloride test is positive. It shows dark green color. Okay, so this is the whole scenario. Now you have to tell me the diagnosis. Alright, I'll put it up once again. Take at least 1 or 2 minutes to go through it and tell me your diagnosis in the comments section. Okay, look at this. I'm going to show you each and every slide for 1 minute each. Just look at it, try and understand why particular tests have been ordered, why this brief history, the history has been briefed, this question has been framed keeping these keywords in mind. Okay, try and understand because this will be asked of you time and again. Okay, and you should know how to start solving clinical questions. Okay. Read it. Come on. Understood? Now, the examination part is easy. Okay. Getting it? The investigations. Very important. You have to order MRI brain. Why are you ordering MRI brain? Because there is development delay. There is a history of seizures. So all these point towards some neurological involvement. Therefore, the best investigation for neurological involvement is MRI. MRI is the best investigation for neurological involvement. Okay. Hi, Jatin. Jatin was 14th, from 14th only your profs were getting started, right? Next, this very important investigation where we measured the serum and the urine amino acids. Okay, now we'll elaborate on the ferric chloride test later on, but first tell me the diagnosis. What did you see? What did you observe? What is the diagnosis here? Tell me. Okay, Jatin. All right. Okay. You tell me the diagnosis. Have you gone through the situation? Have you gone through the scenario, or do you need me to replay it again? Have you made your diagnosis? Come on, tell me, guys. Tell me your diagnosis. What is the diagnosis here? Look at this slide. It is very easy for you to make the diagnosis after looking at this slide. What is raised in the serum? Again, you want to see, okay, starting from the history, look at this. A 1-year-old male child who is born through a consanguineous marriage was brought to the OPD by the parents after they noticed global development delay. That is, he did not achieve the milestones. There is some retardation in the development. Poor visual skills and decreased pigmentation of the skin and hair. Okay, they also give history of episodic rigidity of the lower body. Alright, understood this? Next, on examination, there is the child is average weight for age, that is normal weight, hypopigmented hair and scalp, hypopigmented, increased tone, spasticity, rigidity in the lower limbs, and development delay. Okay, you order an MRI brain. MRI brain shows microcephaly and severe global development delay. Then you order urine and serum amino acids, where you observe serum phenylalanine is raised to 450 micromoles per liter, whereas normally it is around 35 to 75, 31 to 75. Ferric chloride test on the urine is positive and it shows a dark green color on the addition of ferric chloride to the urine sample. Now you tell me, what is the diagnosis? Third time, 3 times we have played. Now you should make the diagnosis. Tell me fast. All this you know. You know what this is. You just have to write. No answer, is it? So now I have given you ample time. Now I'm going to come up with the answer. Okay. So the correct answer is what? Phenyl ketone urea. Serum phenylalanine was raised, no? Serum phenylalanine was raised and ferric chloride test is positive. What is the ferric chloride test? What does ferric chloride test do? Ferric chloride test measures it detects the phenol in the urine, okay? Ferric chloride test detects phenols in the urine. Phenol, okay? It detects phenol in the urine, okay? And it will also detect ketones. Okay, so this phenylalanine gets converted into phenyl pyruvic acid. Phenyl pyruvic acid is a type of ketone, alpha keto acid. And this phenyl keto acid, this phenyl ketone that is excreted in the urine, it is detected by the ferric chloride test and it gives a dark green color. Normally the ferric chloride solution is yellow in color. Okay, the ferric chloride solution is yellow in color, but upon detection of phenol or ketone, different colors it can take: red, purple, dark blue, dark green, all these are positive ferric chloride tests. Okay, understood or not? Tell me. Alright, so what happens is this ferric chloride is positive because it has detected phenyl ketones in the urine. And what are phenyl ketones? Phenyl ketones in the urine. What are phenyl ketones? When phenylalanine is raised, phenylalanine, this is an amino acid. Okay? Phenylalanine is an amino acid. When this is raised in the blood, it will be converted to phenyl ketone. And phenyl ketone is a keto acid. Okay, understood? Understood or not? Great. So, now what is the physiology and what is the management of phenylketonuria? This I'm going to tell you. First of all, this management will come to later on. But can any of you tell me what is the management of phenylketonuria? Does any of you know the management? What is the management of phenylketonuria? When there is rise of phenylalanine, when there is increased phenylalanine in the blood, then it gets converted to phenyl ketone. Phenyl ketone is a keto acid. So the conversion of amino acid to keto acid reversibly, this is a reversible conversion of amino acid to keto acid. This is called transamination. Got it? Transamination reaction is the conversion of amino acid to keto acid and it is reversible. Got it? So this is what is happening here. Phenylalanine, which is an amino acid, is getting converted to phenyl ketone, which is a keto acid. Okay. Now, what happens is phenylalanine, when phenylalanine normally converts to, yes, very good. Jatin knows it. Jatin is telling phenylalanine foods containing phenylalanine are not to be taken. Very good, Jatin. Very nice. So some genetically modified foods and some proteins, genetically modified protein diet supplements are to be given, and those foods that are high in phenylalanine are not to be taken. Okay. We'll come to that later on, but first of all, let us see what happens. What is the normal phenylalanine metabolism? Okay, see, phenylalanine, by the action of the enzyme phenylalanine hydroxylase, gets converted to tyrosine. Okay, now phenylalanine is an essential amino acid because it has to be taken in the diet. It cannot be synthesized in the body. Tyrosine is a non-essential amino acid. Why? Because it can be synthesized inside the body with the help of phenylalanine. Okay, and what is the reaction? Phenylalanine hydroxylase. It also requires a cofactor, that is tetrahydrobiopterin. It is extremely important in this metabolism. Okay, tetrahydrobiopterin is very, very important for this reaction. Why? Because what is phenylketonuria? When there is absence of this enzyme, when this enzyme is not present, deficient, then what happens is phenylalanine cannot be converted into tyrosine, and phenylalanine accumulates. Tyrosine deficiency is there. Okay. Similarly, if tetrahydrobiopterin deficiency is there, then in spite of phenylalanine hydroxylase being present, this cannot function optimally. Okay, so phenylalanine cannot optimally be converted to tyrosine, and again it starts accumulating. Okay, but this deficiency of tetrahydrobiopterin produces a milder phenylketonuria because this enzyme is present but it is not functioning efficiently. Okay, but when this enzyme itself is not present, then the phenylketonuria is severe. So that is called a classical phenylketonuria, and this one, due to deficiency of tetrahydrobiopterin, is called a variant phenylketonuria. Okay, now this phenylalanine keeps on increasing in the body. Okay, now what happens is, see, phenylalanine hydroxylase deficiency causes the buildup of phenylalanine and deficiency of tyrosine. Okay, now what happens is, this phenylalanine, it causes a lot of neurological symptoms, and the skin symptoms, the signs and symptoms related to the skin and the hair are because of deficiency of tyrosine. Okay, now we'll see why and how. Phenylalanine is a LNAA. What is LNAA? It is a large neutral amino acid. Large neutral amino acid. Okay. Its name is so large. So it is, you can see how large it is. Okay. So it is a large neutral amino acid. It crosses the blood-brain barrier through this transporter. This transporter is large neutral amino acid transporter. Okay, now this phenylalanine will cross the blood-brain barrier through this transporter and it will enter the brain. Okay, for different functions, whatever functions it has to undergo. Similarly, there are a lot of other large neutral amino acids that use the same transporter. This transporter is present between the blood in the blood-brain barrier. Okay, so these amino acids that are traveling in the brain, they will cross through this barrier, through this channel, this transporter, and get inside the brain. Okay, now they are functioning efficiently. All these are slowly getting through this channel. Okay, suppose this channel is a small tunnel, and these are the passengers. These LNAs are the passengers that have to go. Now suppose there is one passenger that is occupying, one passenger has got all his family members, all his friends and all, and they are occupying most of the space in the tunnel. Okay, so this phenylalanine has accumulated, this large neutral amino acid phenylalanine has accumulated in the body, and most of the time it is only getting transported through the transporter. The other large neutral amino acids cannot cross this transporter because this has crowded here. Phenylalanine has crowded this tunnel. So the other spectators will be left behind. So the other large neutral amino acids will be left behind here. Now what happens is, because they are all necessary for neurological development, neurotransmitter synthesis, so when they will not be able to enter the brain, there will be neurological symptoms like microcephaly. Like, what is this? Microcephaly, behavioral abnormalities, attention deficit hyperactivity disorder, ADHD. What is ADHD? The person will start, the child will start repeating the same thing again and again. You'll start doing these things. Okay, these are repetitive behavior and hyperactive behavior. That means you'll start jumping around here and there, become violent, start throwing things here and there just to attract attention. So this is a type of a neurological abnormality because of deficiency of essential neurotransmitters, because of deficiency of large neutral amino acids which can cross through the transporter because of excess of phenylalanine. Understood? And one very important keyword is the musty odor. Musty odor is also present. Understood? Now the deficiency of tyrosine will cause reduced pigmentation of the skin and the hair. Why? Why is it so? Because tyrosine gets converted into melanin. Okay, tyrosine gets converted into melanin. Very important. Okay, so because of deficiency of tyrosine, there will be deficiency of melanin as well. Alright, got it? Now, what did I tell you about the second type of deficiency? That was tetrahydrobiopterin. isn't it? Now when tetrahydrobiopterin is deficient, what happens is it can also lead to accumulation of phenylalanine and deficiency of tyrosine. But this is a rarer and a milder form. Okay. Now how will you differentiate between these two? It is very important. Okay. Now tyrosine goes on to form L-DOPA. Tyrosine goes on to form L-DOPA and dopamine by the action of the enzyme tyrosine hydroxylase. This tyrosine hydroxylase also requires tetrahydrobiopterin as the cofactor. Getting it? And this dopamine, that is the final product here, it will inhibit prolactin synthesis. So, whenever dopamine is getting synthesized, it will inhibit the synthesis of prolactin. Okay. So, what do? We will feed this person who has phenylketonuria, we will feed him with tyrosine. Okay. And now we will check the serum prolactin levels. Okay. Now, suppose he has deficiency of phenylalanine hydroxylase. Okay. Now, we have given him tyrosine. This tyrosine can very easily undergo conversion to L-DOPA by the action of tyrosine hydroxylase because it is present, by the action of tetrahydrobiopterin because it is present, and it will get converted to dopamine and it will inhibit prolactin synthesis. So, the serum prolactin level will be low. So, if the serum prolactin level is low, we can confirm that the deficiency is due to phenylalanine hydroxylase enzyme. The phenylketonuria is due to deficiency of phenylalanine hydroxylase. But suppose there is deficiency of tetrahydrobiopterin. Okay. Now what do? You give him tyrosine. Now this tetrahydrobiopterin is required for this reaction. It is required as a cofactor for tyrosine hydroxylase. Now, if this tetrahydrobiopterin is not present, then this L-DOPA will not be synthesized, dopamine will not be synthesized, and prolactin will be high. So, if after giving tyrosine, the serum prolactin level is high, that means the deficiency is that of tetrahydrobiopterin. So, you understood how to differentiate between these two? Understood or not? Getting it, all of you? Very, very important. It is extremely important to differentiate between these two. Okay. Now, one important thing is that phenylketonuria is inherited through autosomal recessive inheritance. Now, you get back to the question. The question showed consanguinity, isn't it? There is consanguineous marriage, consanguinity, that is marrying amongst blood relatives. So this increases autosomal recessive inheritance. Autosomal recessive transmission is increased because of consanguinity. So understood? Each and every keyword was important in the question. Okay. Now, phenylketonuria is inherited through autosomal recessive transmission. Therefore, in cases where consanguineous marriage is there, it is very important to do the Guthrie's test just after birth. Not just after birth, around in the first week of birth. Okay, in the first week, around day 3 to 5, you should conduct the Guthrie's test. Okay, around day 3 to day 5. How is it done? Through heel prick. Through the heel prick. Heel prick test is also used to measure the serum thyroid levels, isn't it? In the infant. So, through heel prick, you take out the blood, and this is the screening test for phenylketonuria in the infant. Here, you detect the phenylalanine concentration and you take out the ratio of phenylalanine to tyrosine. Both of them will be high, and understandably so, because phenylalanine is raised, so its absolute concentration will be raised, and the ratio will also be high because tyrosine is low and phenylalanine is high. Okay, understood or not? Got it? So this is the Guthrie's test. So you understood how to differentiate between classical and the variant forms of phenylketonuria. Jatin, it is not contagious, it is consanguineous. Consanguineous is con and sanguineous. Sanguine is blood. Sanguine is blood. Sanguine is related to blood, and con means same, similar, within. So this is what marrying within blood relatives. Marriage within blood relatives is called consanguineous marriage. It is practiced in certain communities, in certain areas. So this is where autosomal recessive transmission is precipitated. Okay, understood or not? So therefore, we have to screen for autosomal recessive diseases there. Okay, got it? Understood everything to differentiate between classical and variant form of phenylketonuria. What is the Guthrie's test? What is the ferric chloride test? What is the role of tetrahydrobiopterin? Why are the neurological symptoms occurring? Why are the skin and the hair hypopigmented? Okay, what is the management? Jatin has already told the management is restriction, is dietary modification. Dietary modification where we restrict phenylalanine in the diet, and we give there are a lot of genetically modified supplementation that is coming. But because there is more or less restriction, you have to restrict the protein also. Restrict the amount of protein per day. Okay, in the diet. So therefore, in the long run, it leads to a lot of bone density gets reduced, and a lot of growth abnormalities also, because amino acids and all proteins are the building blocks, isn't it? So it leads to a lot of defects. But if phenylalanine is allowed unrestricted, then it will lead to a lot of neurological symptoms, so that have to be avoided at any cost. Okay, so there is a uh, lot of research going on regarding the dietary requirements, and it has been this disease has been in the news. This disease has been discovered for quite a long time, so there has been quite a lot of research, and they have come up with a lot of GM, genetically modified dietary supplements. So there has been a lot of respite for the phenylketonuria patients. Alright, it is very, very important to diagnose it as early as possible before any neurological symptoms set in. Okay, so Guthrie's test is very important as screening. Understood? Okay, so now we'll take a break and then we'll start the next session on clinical biochemistry after 5 to 10 minutes. And if you haven't subscribed to this channel, then please do subscribe to it and share this amongst your friends, so that we have such interactive sessions and we increase the reach amongst all the students, and they also benefit from this.